Hi, in this video, I'm going to show you how you can do some self-massage, some self-release of the pelvic floor muscles. You will need a ball, preferably not a lacrosse ball or a tennis ball. I find they're a little bit too hard, and the muscles and tissues that we're working on are a little more delicate than if you're getting stuck into your glutes. So save the lacrosse ball for your butt. Find something a little bit softer for the pelvic floor. So this is just an air-filled rubber ball, which works really well. And then rummaging through my house, I found a dryer ball and tested it out, and it actually feels pretty good too. So that one's gone away. We'll use this one anyway. The pelvis, we can see here, we've got the bony structures of the pelvis, and then looking down, you can see all the deeper muscles of the pelvic floor. Of course, there's organs in there which are not shown at the moment, but if we turn the pelvis this way, you can see the sit bones at the bottom. Your tailbone is more towards the back. We have the urethra, the entrance of the vagina, and then the anus. And we know that during a vaginal birth, these bones will widen, they will open to create a little bit more space, but they need the muscles that are sitting between all of these bones to be able to lengthen and be supple enough to allow that opening of the obstetric outlet where baby needs to pass through. The muscles themselves also need to lengthen and open to allow baby to get through that otherwise quite small space. And then this technique can also be really helpful for releasing tightness, muscle tension through the pelvic floor. When the pelvic floor muscles are really tight, it can create discomfort or pain through the pelvis. It can limit the circulation or flow through the pelvic floor, creating a bit more of a heavy sensation. Tightness here can also contribute to pubic symphysis pain, sacroiliac joint pain, and absolutely coccyx or tailbone pain as well. So this exercise can be used as a way of doing some self-treatment, as well as a great way of preparing for birth. So I'm going to demonstrate on the model first, and then I'll show you how I do it on myself. If we can find those bony landmarks first, so the sit bones, if you were sitting and you slid a hand under your bum, you should feel two bony landmarks on either side, and that's actually where we're going to start. There's a lot of muscles that attach to these bony landmarks, and so if you can slide the ball underneath your bum, you're going to start around one of those sit bones, and you can just explore. There's no perfect position, really. What I find is most helpful is just moving around, leaning a little bit to see, are there any points that feel maybe a little more tender, might feel like a tight muscle, or does it actually feel okay? So explore there for a little bit. If there are any sticky points, you can stay and breathe there for a bit longer. And then we want to compare that to the other side. So heading over towards the sit bone on the opposite side, you're going to place the ball there. Again, just lean, explore around, see if there's any areas that are a little more tender, which might need a little bit more attention, or get you to breathe right down into those areas. Once that's feeling like you've had enough, or if it's feeling good, you can move the ball inwards. So I think of this kind of crease or this pocket between the labia and the sit bone. We have all of this space that we could access the pelvic floor muscles a bit more directly. Again, being really respectful of any discomfort. We don't want to push through a lot of pain. These are sensitive tissues, and we want to just ease into it. So if this is the first time you've done it and things are quite sensitive, maybe just do 10-15 seconds in each spot before moving on to the next one. And then over time, it should get a little more comfortable and a little easier to do. So we've got the ball now. You can explore all through this pocket on one side, And then of course doing the same on the opposite side, just noticing, is there any difference side to side? Or is it pretty similar? Or does it actually feel quite good? If so, fabulous and good for you. The final spot, if you feel comfortable trying it, is on the perineum itself. So right in that area of muscle and skin between the vagina and the anus, you'd want to rest the ball there. This position, I find I'm not as keen to move around on it, but rather I try to breathe deeply and let the muscles almost melt or mold over the ball, and encouraging that softness and lengthening through the perineum. Okay, so I'll show you how I work on it myself. Ball, you know, a lot of people will find doing this sitting on a chair to be an easier position. I find you can really play with how intense you want the pressure. A firmer seat, a harder chair is going to be a lot more pressure compared to something softer like a couch. So that could be a place to start if this is quite tender for you. And you can use your hands on the couch to take a little bit of that pressure off and deload if it's too much. I've been finding this actually works really well for me on the floor, and then the ball doesn't roll off the chair either. So I'm going to slide that under my bum while I'm sitting here, and finding that sit bone, I'm just leaning and exploring, are there any areas that are a little tighter or a little more tender, and just respecting any pain, but starting to work through some of those sticky spots. If you're comfortable, you can experiment with different positions and rotations of the leg, moving through whatever feels good. Oh, there's a good spot. Okay. And then once I'm finished working around that sit bone area, I'm going to swap to the other side. So now under the sit bone on the opposite side. Actually, I think the floor is a great place to do it because you don't have your whole body weight resting on your seat. Half of my body weight's resting all over the floor. So it actually feels a bit easier to control and fairly comfortable to be here doing this. But of course, do whatever works best for you. Move around a little and just see where are those tender and sticky spots. And then once I've finished working around the sit bone, I'm going to let the ball move more inwards. So between the sit bone and the labia, we're not in the midline, we're not directly pressing on the anus or the vagina itself, but working in that pocket of muscle. Around here, you might be able to get a little closer back toward the tailbone if that's been bothering you. And then if you find a particularly sticky or tender spot and it's not too intense, you can just rest into it, letting the pelvic floor lengthen with each inhale. It'll feel like it's pressing into the ball a little bit. And then with the exhale, I imagine just letting the muscles melt around over top of the ball. All right, moving that to the other side. So between the sit bone and the labia again, in that pocket of muscles. So right now I'm a little more towards the tailbone, so towards the back, in this pocket back here. And to be perfectly honest, my tailbone has been bothering me, especially noticeable after sitting or driving for a while. And my pubic bone has not been happy. But this release has actually made quite a big difference in how I'm able to go about my day and function. Okay, and another sticky spot, I'm going to do a few deeper breaths here. See if I can relax and melt over that ball. Okay. And then you can take the ball more into the middle, so into the perineum, between the vagina and the anus. So you can explore a little and see what position feels comfortable. I am taking a bit more pressure through my hands because a bit more of a direct pressure on the pelvic floor with this one. Another position you could try could be kneeling. I feel like I'm hatching an egg. Yeah. And you could experiment with a little bit of mobility side to side, a little bit of pelvic tilting. Really, there's no perfect angle or way to do this release, but rather knowing where the muscles are that you want to target and respecting any discomfort that might be saying that's a little bit too much right now. But this can be such a beautiful exercise, as I mentioned, for addressing pelvic pain, pelvic girdle pain, and preparing for birth. So if you can find yourself a ball, then I would encourage you to give it a go. And I hope that you see some benefit from doing that exercise too.